Alright, this scenario is for the Verapamil. Pat Smith is an 82-year-old male with a diagnosis of weakness and dizziness. The heart monitor he's wearing is alarming with a narrow complex of ventricular tachycardia. We've got D5 half normal saline at 83 mils that's running right now through his peripheral IV. So even though we've got a double lumen here, we're just pretending it's got one. And then it's peripheral and not the central line. We have directions right now to administer meds at 10:05. Right now it's 10 o'clock, or the orders were put in at 10. For Verapamil at 5 milligrams IV now, and to repeat the dose in 30 minutes if no response occurs. So we've got his allergies here to morphine, which won't contraindicate anything. So the first thing we're going to do is, if I haven't met my patient for some odd reason by this point, I'll go in and let the patient know who I am. We're going to explain to them that what's going on is their heart's beating a little funny right now, it's beating a little fast, kind of irregular, so we're going to give them some of this med to see if we can regulate their heart rate again. Explain to them that because this D5 half normal saline is not compatible with the Verapamil, that we're going to need to do it a little bit differently, so we can't just push it in, just so that they understand why we're flushing before and after and not wondering why some do and some don't. Make sure if we have any questions, now that we've got them answered. So then I'm going to double check name and date of birth on the wristband. We'll go through all the 5 rights, so right drug, right route, right patient, right amount, and over the right amount of time. In this case, we've been told to give 5 milligrams, which with this 2.5 milligrams per mil, we know we're given 2 milliliters, and we know we have to give it over at least 2 minutes. The other thing that we'd want to have on hand, well, at this point I'd wash my hands, put my gloves on. We're going to want to have either calcium chloride or glucagon on hand. Both of those are antidotes for toxicity. So if we end up, his body doesn't react well to it or anything, it's within the required dose, so it's okay to give, theoretically, but everyone's body reacts differently. So we either want to have it on hand or order in the Pyxis already, so we're not having to fight with it. So I am going to scrub this for 15 seconds. Draw up my dose of 2 mils. And we could dilute this if we need to, but 2 mils is a pretty easy amount to give over 2 minutes, so I'm not going to. I don't think it's really necessary for this one. Alright, so recap this, maintaining sterility here. Done with that. So now, I've got this running right now at 83 mils an hour. I'm going to make sure I stop that. So we're going to stop that for now. With my site here, we'll go ahead and clean this off. Do that for 15 seconds. Alright, I'm going to make sure I clamp this pretty good here. I want to make sure it's completely clamped off, so we're not going to have any backflow. We'll flush it with 10 mils first, so there would have been a cap on here. Keep it all sterile. So we're going to flush this. Alright, so I've got that flushed. Now we can do our med. I'm still going to keep this clamped though because I don't want them to mix. Alright, so now I've got my 2 mils that I'm giving over at least 2 minutes. So about, a quarter of a mil every 15 seconds kind of thing. So I'll make sure I can get it all in there, half a mil every 15. So for this case, we'll say my 2 minutes are done, so I've made sure to use my minimum. And again, because it's not compatible, we need to flush with another one. So we'll get this covered off here. And sure, keep it all sterile, still And then this one needs to go, we'll just still do the full 10, but we're gonna do this over the 2 minutes just like we did the Verapamil. So, we'll just say we're going over 2 minutes here. This is just alarming me that it's been sitting there for 2 minutes, which is a good sign that I know for sure I'm doing my stuff slow. Alright, so now we're done with our meds. We can unclamp this, and then we can start this up again. So now we got our meds pumping again. Because we flushed it before and after, we shouldn't have to worry about incompatibility. We are going to watch for any kind of reactions to it, which we really shouldn't have to worry about too much. The biggest thing that we're looking for here is abdominal discomfort or bradycardia. We're trying to lower the heart rate as it is, so lowering it a little bit is okay. We just want to make sure it doesn't go too low. So other than that, we should be good to go with everything.